I know that I personally want to drink one of these almost every day. Raise your hand if you rely on consuming extra caffeine during the day, whether it's coffee or an energy drink. Well, this reliance could be known as a form of addiction. According to the 2023 United States National Survey on Drug Use and Health, 48.5 million Americans battle a substance use disorder within the past year. I've always been interested in psychology, but never knew what path I should take. However, dealing with a family that has addiction problems, I've gained a passion for helping those who need it. An addiction therapist has a significant impact on a substance abuser's recovery. Throughout my speech, I will cover what defines an addict, crucial skills that are needed as an addiction therapist, and treatment and resources that are given for recovery. Understanding addiction and what makes an addict is crucial to know as an addiction therapist. According to the American Society of Addiction Medicine, addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, environment, and an individual's life experiences. People with addictions use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Addictions can range from a variety of things, but it is mostly drugs and alcohol. People can be physically and psychologically dependent on these substances. When someone abuses high doses of an addicted substance, they may develop a physical dependence. This means that they will experience negative side effects when they stop using the substance. A physical addiction may also happen because the substance has altered the chemicals within the brain. A psychological dependence refers to someone feeling like they cannot function normally without the use of the substance or activity. Being an addiction therapist requires a specific skill set and certifications. These traits include empathy, resilience, and the ability to be non-judgmental. According to Psychology Today, empathy, compassion, and understanding are the components that help form a trusting relationship between the therapist and client. Trust is necessary for open and honest communication, which leads to the client being able to address the root cause of their addiction. Resilience is a characteristic that therapists need because of the emotional toll this work can take on them. Oftentimes, therapists can suffer from compassion fatigue from providing care for a period of time. This can result in a loss of interest in their job and less compassion for their patient, which is why resilience is such an important quality to have. Therapists in this setting need to be able to be good at taking care of themselves as well as taking care of others in order to prevent burnt out. There are various levels of addiction counseling that someone could choose from to get into. The traditional education and formal training would depend on what type of therapy or counseling the therapist would like to provide. Certain associate degrees could qualify someone for a position as a counselor, and addiction physicians are required to have their medical degree. An addiction therapist's role is to guide their patients to and through recovery. This diagram points out that only 35% of people battling substance abuse seek help. However, the 90% of the people who do recover successfully. Therapists are trained to offer support, encouragement, and practical strategies to help their clients regain control over their lives. As explained by the University of Cincinnati, therapy can come in many forms and can be individual, group, or family counseling. Working with a therapist can continue indefinitely to ensure long-term recovery. This strategy helps addicts prevent relapse or helps them recover after a relapse. The goal is to provide addicts with the tools to maintain healthier life behaviors. Resources to recover from addiction come in many forms. For dependencies, inpatient facilities work best to provide constant care, monitoring, and counseling. For some people, therapy can be found through many different places, such as hospitals, schools and employers, or community resources. For instance, CGCC students have access to resources on this campus, such as counseling. This counseling is able to help all of us with personal difficulties and can refer us to other help when needed. With me, I have a few flyers that are available for anyone to take. They describe what areas of counseling are available and has a list of additional resources. In conclusion, we have covered many topics that deal with addiction therapy, including what defines addiction, crucial skills that are needed as an addiction therapist, and treatment and resources that are given for recovery. Hopefully we have learned some ways to identify addiction and the 3 resources that are available in your community. I hope that the information I provided in this speech has helped everyone learn how to identify addiction and how to find resources. Thank you.